Have you or a loved one been diagnosed with osteoporosis or bone loss? If so, you may have heard of Prolia, denosumab, a prescription medication designed to strengthen bones and reduce the risk of fractures. Osteoporosis affects millions of people worldwide, especially postmenopausal women and older adults. As bones lose density over time, they become weaker and more prone to fractures, making daily activities riskier. Prolia is a treatment that helps slow down bone loss and improve bone strength, making it an essential option for many patients. If you're considering Prolia or just want to learn more, here are 10 key facts to help you understand what it is, how it works, and whether it might be right for you. Number 1. What is Prolia? Prolia is a prescription medication used to treat osteoporosis and prevent bone fractures. It is a type of monoclonal antibody that works by targeting a protein called RANK ligand, which plays a key role in bone breakdown. Unlike other osteoporosis medications, such as bisphosphonates, which slow down bone loss, Prolia actively blocks the process that leads to bone weakening. This helps increase bone density and reduce the risk of fractures, particularly in postmenopausal women, men with osteoporosis, and patients undergoing certain cancer treatments that affect bone strength. Number 2. How does Prolia work? Our bones are constantly breaking down and rebuilding. In osteoporosis, the breakdown process happens faster than the rebuilding, leading to weaker, more fragile bones. Prolia works by inhibiting RANK ligand, a protein that stimulates bone-resorbing cells called osteoclasts. By blocking this protein, Prolia reduces bone loss and helps maintain bone density. Unlike some other osteoporosis treatments, Prolia is not a hormone or a bisphosphonate, making it a unique and effective option for bone health. Number 3. Who can take Prolia? Prolia is prescribed for postmenopausal women with osteoporosis who are at high risk for fractures, men with osteoporosis who have a high risk of fractures, patients with osteoporosis who cannot tolerate other treatments or have not responded well to them, people taking medications such as corticosteroids that cause bone loss, men receiving hormone therapy for prostate cancer, or women undergoing breast cancer treatment that weakens bones. It is important to consult with a doctor to determine if Prolia is the right treatment for your condition. Number 4. How effective is Prolia? Clinical studies have shown that Prolia significantly reduces fracture risk in people with osteoporosis. Research has found that it reduces spine fractures by up to 68%. It lowers the risk of hip fractures by 40%. It increases bone mineral density, BMD, in the spine and hip. Because of its effectiveness, Prolia is often recommended for patients at high risk of fractures who need a stronger treatment than traditional osteoporosis medications. Number 5. How is Prolia administered? Prolia is not a daily pill like many other osteoporosis medications. Instead, it is given as a subcutaneous injection under the skin every 6 months. A healthcare provider administers the injection, usually in the upper arm, thigh, or abdomen. This twice-a-year schedule makes it a convenient option for people who struggle to remember daily or weekly medications. However, it's crucial to stay on schedule with Prolia injections. Missing a dose can lead to rapid bone loss and an increased risk of fractures. Check out the full video on our YouTube channel to know more. Number 6. What are the side effects of Prolia? Like any medication, Prolia has potential side effects. The most common include joint and muscle pain, back pain, fatigue, skin infections such as cellulitis, and low calcium levels, hypocalcemia. More serious but rare side effects include osteonecrosis of the jaw, or ONJ, a rare condition where the jawbone weakens, atypical femur fractures, unusual fractures in the thigh bone, and severe allergic reactions. Because Prolia affects bone remodeling, patients must stay consistent with their doses and maintain good dental hygiene to reduce the risk of ONJ. Number 7. How does Prolia compare to other osteoporosis treatments? Prolia stands out from other osteoporosis treatments due to its unique mechanism and dosing schedule. Unlike bisphosphonates, which slow bone loss, Prolia directly blocks the RANK ligand protein to prevent bone breakdown. It is given as a twice-yearly injection, making it more convenient than bisphosphonates, which require weekly pills or annual IV infusions. Prolia is also an alternative for those who experience digestive issues with oral medications. Compared to teriparatide, Forteo, which requires daily injections, Prolia offers a simpler option. However, stopping Prolia can lead to rapid bone loss, so transitioning to another medication is necessary. Number 8. What happens if you stop taking Prolia? Unlike some osteoporosis medications, stopping Prolia suddenly can be dangerous. When Prolia is discontinued, bone breakdown can accelerate rapidly, leading to a higher risk of fractures, especially in the spine. To prevent this, doctors may recommend transitioning to a bisphosphonate or another osteoporosis medication after stopping Prolia. It is essential to work closely with a healthcare provider when considering any changes to treatment. Number 9. Can Prolia be used for other conditions? Although Prolia is primarily used for osteoporosis, it is also approved for bone loss due to cancer treatments. Men receiving hormone therapy for prostate cancer and women undergoing breast cancer therapy often experience rapid bone loss. Prolia helps protect their bone density. Glucocorticoid-induced osteoporosis. Long-term steroid use can weaken bones, and Prolia can help reduce this risk. Researchers continue to explore additional potential uses for Prolia, particularly in bone-related diseases. Number 10. Should you take Prolia? If you are at high risk for fractures, have severe osteoporosis, or have not responded well to other osteoporosis medications, Prolia may be a good option. However, it's essential to discuss the potential benefits and risks with a doctor. Before starting Prolia, you should have your calcium and vitamin D levels checked, since Prolia can lower calcium levels. Discuss any dental issues to reduce the risk of jaw complications. Make a plan to stay on schedule with injections to prevent bone loss after stopping treatment. Prolia is a powerful and effective treatment, but it requires careful monitoring to ensure safety and long-term success. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.